We're presenting results from a number of different programs. One program we're particularly excited about is our SGLT2 inhibitor, which is part of our collaboration with Pfizer. And at this meeting, we have a large phase 3 program with a number of different studies, but at this meeting, we're presenting the results of two large phase 3 studies. One is a study in patients with inadequate control on diet and exercise, and another study is an add-on to metformin study. The first study is our monotherapy study. So these are patients with type 2 diabetes who had inadequate control on diet and exercise, and we looked at the addition of ergogliflozin compared to placebo over a 24-week period. In that trial, after 26 weeks, we saw really nice reductions in A1C, 1.16% at the top dose of 15 milligrams and 0.99 at the dose of 5 milligrams compared to placebo. We saw improvements in fasting glucose that were very nice as well. We saw reductions in body weight and a trend towards an improvement in systolic blood pressure as well. We saw no meaningful increase in hypoglycemia, and the safety profile suggests a good tolerability with a profile that's very similar to what's been reported with other SGLT2 inhibitors. So it's very exciting data to us, showing that ergogliflozin provides really nice efficacy and a very favorable profile, we believe. The other study is a very interesting study that we conducted, a factorial study, looking at the combination of sitagliptin and ergogliflozin. And the idea there is to take two agents that have different mechanisms of action, ergogliflozin lowering glucose by partitioning glucose out of the system, and sitagliptin, a DPP-4 inhibitor, augmenting the endogenous incretin axis, increasing GLP-1 and GIP levels, improving insulin secretion, reducing glucagon. And so taking these two very different mechanisms that both lower glucose and adding them together, we thought would be a very interesting and useful and clinically important, potentially important combination. We did a study in patients with inadequate control on metformin in monotherapy, and patients who had elevated A1C coming into the study. We added that combination of sitagliptin plus ergogliflozin, and we compared it to ergogliflozin alone or to sitagliptin alone over a 26-week period. What we found was that each of the individual treatments, sitagliptin alone and ergogliflozin alone, provided nice reductions, 1% or so reductions in A1C. But when we added the combination, we saw really very, very strong reductions in A1C, 1.5% reductions. One of the nice observations as well was that we saw that about 50% of patients who were starting off inadequately controlled got to glycemic goal of less than 7%. And then we also saw nice reductions in body weight, reductions in fasting glucose, improvements in systolic blood pressure, and no meaningful increase in hypoglycemia, and the overall tolerability profile and safety profile very similar to what one would expect with an SGLT2 inhibitor, increase in genital infections, which is typically seen with this class, but overall with good tolerance, and as I said, with an efficacy profile that we thought was a very useful one that gave us, I think, some confidence to think that this combination will be a really clinically useful one for physicians potentially. Many of our studies continue to go out to a year, and we do have studies that will even go out to 2 years of treatment. And of course, we're also doing a large CV safety study and CV outcome trial that will look at even longer durations of treatment. Of course, we have to start somewhere, and so important to look at the initial 6 months or so of treatment. We'll continue to want to look at treatment that goes out further than that and look at observations over longer periods of time, and that's part of our program as well. But these are the first data that we're presenting, and it's to us very encouraging to see such nice results over 6 months of treatment. Our Program covers a wide range of patients with type 2 diabetes. So this is not patients with prediabetes. This is in patients prior to the diagnosis of diabetes. But it is looking at patients both relatively early. So for example, the monotherapy trial that I mentioned, looking at patients who are failing diet and exercise, those patients are relatively early in the course of diabetes. And yet, in the factorial study, looking at patients failing metformin, they're a little bit further along. And then we have trials looking at add-on to Met plus sitagliptin, and those patients are even a little further in the duration of their disease. The patients in our CV outcome trial, many of those have even longer standing diabetes or on insulin and other treatments. So the program includes a fairly wide range of patients, from new onset to patients who've had diabetes for a number of years. And we think this medication will be helpful across a wide spectrum of patients with diabetes, from new onset to more longer standing disease. And of course, our program over time will develop data across that spectrum.